You probably have a lot of questions, so do we. We wanted to bring Dr. Alok Patel from Stanford Children's Health. Thank you so much for your time tonight, Doctor. Glad to have you with us. We have a lot of questions for you. We're going to go through rapid fire, cover as much ground as possible. So it certainly seems that Omicron is more contagious. Do we know specifically how it is spreading this much faster than Delta?
Well, Deirdre, there's multiple lab studies out there showing that it does spread pretty rapidly by a magnitude of up to 70 times in some studies in certain tissue in the body. But if we look at the real world data and we see that doubling amount, how it's doubling in some areas of the world in 2 to 3 days, that is a big step above Delta. But as you said, this doesn't necessarily mean it's more virulent or more dangerous than the Delta strain, but it definitely looks like it's more transmissible.
Okay, so not cause for alarm necessarily at the moment. I want to refer to Dr. Fauci, who has mentioned a limited number of PCR tests don't catch the variant. So to what extent, in your view, is this reason for concern?
So that alone, there is a little bit of a reason concern there, because as we've seen these reports of people testing negative, then going to a gathering, and they're winding up testing positive later on from the Omicron variant, or for someone who said, hey, I tested negative, I should be okay. That is something that we're going to get more real-time data analysis of. But even if we look at testing, if you're taking multiple tests, you should say like, hey, I have a good chance of catching a positive test if I was exposed. But right now, Deirdre, we're looking at about 1.5, 1.7 million tests a day in the United States. With modelings projected, we need to double, if not triple that amount as we head into a winter surge.
Is protection simply about how close you are to your last dose of any mRNA vaccine, or is it about the number of doses you have? Meaning, does having a booster shot mean more protection versus if you just got your second dose?
That's a great question. And, it does look like the antibody levels are starting to wane after 6 months. And so it's possible that we should stop using the term booster and just call this the third dose in a 3-dose series. But Deirdre, a couple of really important things is those first 2 shots are still very effective at preventing severe illness, hospitalizations, or death, which is what the vaccines were designed to do in the first place. But also, it's important, a lot of these lab studies out there are just looking at waning antibody levels of the immune response from the vaccines, when we know the other arm of your immune system, the T cells, are still pretty effective. So everyone out there should understand that the vaccines still work really well, but you get all 3 and you have great protection against Delta and Omicron that may actually last for a very long time.
Okay, good to know. Dr. Fauci, again, I'm referencing him, says he feels comfortable seeing vaccinated friends or family who have been exposed to COVID recently but have not tested positive. In that scenario, would you?
I feel comfortable in that scenario as well. Now, I can't predict how Dr. Fauci is handling his holiday gatherings, but for me personally, I will tell you what I'm doing right now. I'm in Phoenix, Arizona, where I grew up. We're having a gathering later. Everyone coming is vaccinated. There's a few people who are not yet boosted. There are people who have a little bit more concern. They're going to go out there. They're going to get tested. We have antigen tests. The first round of our white elephant party might include antigen tests for everyone, but that's what we're doing because that's a way that we can all be safe and we can get together and party like it's 2019.
Even with this idea that maybe not all tests catch everything?
I think that's why those who are concerned, those who have been exposed in the past, are taking multiple tests. So they're taking an antigen test in multiple days in a row, or they're taking multiple PCRs if there is a concern that they've been exposed. I think that's the important thing is people out there understand their own individual scenarios. They understand what their work exposure looks like, what their travel exposure looks like, what community they live in. These are all really important factors to take into account.
Okay, but clearly you are comfortable getting on an airplane. Would you be comfortable eating in a restaurant indoors, meaning with strangers?
Now, if these strangers are in a state where we're indoors and you don't have to be vaccinated, I'm a lot less comfortable. In California or New York, for example, there is a vaccine mandate if you're going to go to an establishment indoor and eat or drink. I feel much more comfortable in that scenario to do something like that. And you mentioned airplanes. We're all wearing masks on airplanes. And I don't know if that's something that I'm going to take off well after the pandemic. I feel like that's just a great idea in general.
I like the idea well after the pandemic. Dr. Patel, some schools already moving to virtual schooling, colleges scaling back or canceling in-person learning. Do you see a lot of learning in the next few months happening out of school or off campus?
I hope not. I'm just going to bluntly say that. I hope that we can do everything we can to keep students in person when applicable, because we know that's the best way they learn. And, I think it's important that we look at the new CDC data about testing to stay, meaning if there's exposures, what can we do in terms of screening and testing to make sure kids can stay in school? I wouldn't want to see a reflective activity where a few kids test positive and all of a sudden we're shutting down the entire school, rather than trying to isolate a certain group or screen ahead of time. That's something that we need to really pay attention to as we continuously see numbers rise.
Speaking of a certain group and kids, younger ones, so 2 to 5 years old, may have to wait months longer to get a shot of a vaccine. Pfizer, of course, announcing that setback earlier. What does this mean to you as we fight this virus?
This was such a huge setback, not only for myself, but for a lot of parents out there who are really looking forward to giving their kids that extra protection. What this means for me is that people are going to have to hang on a little bit longer and do what they've been doing to protect those kids, especially those young kids aged 2 to 5 who so desperately want to get back to their old lives. And it's important that we pay attention to this. According to the American Academy of Pediatrics, we're entering our 18th week with over 100,000 positive tests in children. And these are children who are vulnerable. We've done a great job of protecting them, so they may not have a high level of natural immunity. And this is exactly the population that Omicron wants to target.
Yeah, and it's also hard for them to understand all the rules to follow. Dr. Alok Patel, thank you so much for the time and lending us your expertise.
Thank you, and happy holidays.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.